Hey beauties, welcome back to my channel. Today we are here with the fabulous Jamie teaching me about a new stretching technique, and I'm going to let her explain exactly what it is.
Hi guys. So Tara and I are going to be doing a fascial stretch therapy session, FST. It is a type of body therapy that is heavily emphasized on passive movement. It's very therapeutic. It's very good for rehabilitation and recovery. It's also very good to decrease any sort of joint pain. Tara came in with a little bit of a hip compromise. We're gonna address that. The key point about this therapy to remember, in contrast to other types of stretching therapy you're gonna start hearing a lot about, is this therapy is specifically targeted to the fascia of the body. It is a separate tissue from nervous tissue and muscle tissue. And this particular therapy targets the fascia in a way that basically ripples throughout the whole entire system. So when you watch the video with Tara and I, you'll see that I'll do a lot of stretches with her legs, I'll do a little bit of movement with her hips, but just in doing those movements and those stretches, I am essentially affecting a line that goes all the way up to her neck. So I can spend an hour with Tara and never touch her shoulders, never touch her neck, never touch her back, and essentially achieve the same goal as doing an hour of soft tissue massage that someone might do regularly. So we're very excited. Tara's been doing a lot of working out, so this is going to be very advantageous for her recovery. It's also going to be advantageous for her movement patterns. If she has any sort of weakness in a squat or any sort of weakness in any other type of movements, we can help address that and hopefully neurologically assist in progress.
Now, do you base like what you decide to do for a client, like on a client? Like if they come with you, like would you choose to do this type of stretching versus just regular massage, or?
Absolutely.
Okay.
So it's a case-to-case basis.
Gotcha. I was all jammed up, so she was like, I don't know what I'm going to choose.
Case-to-case basis, and I think that any therapist would agree that no modality is a standalone modality. You always want to try to incorporate as many tools as you have as possible. The efficacy of this type of an approach is ideally the most effective when it is done as all a stretch.
Right.
If we get into a situation where there's an excessive amount of tightness for your hip, for example, we can certainly utilize some soft tissue techniques, which essentially are the classic massage techniques that most people are familiar with.
And you can incorporate that right into a session when you're doing the...
Absolutely.
Gotcha.
Or vice versa, right? I strongly believe that I can look at a body and I can do an assessment and I can say, okay, this is what I think that you need.
Right.
However, it's much more important that you are the person on the table feeling and receiving the therapy.
Right.
So if you come in wanting a certain modality, I'm going to gravitate towards that. And then as we work through it, I'm going to give you the best treatment, which might not be what it was that you had anticipated.
Gotcha.
So in the ideal universe, all of them wind up going together.
Awesome.
And yes, it always depends. Some people respond very well. Other people don't respond very well.
Right.
But you could come in and give me the same complaints as somebody else coming in.
Right.
And if I start to stretch that person's body and they immediately don't respond to it, then we switch the therapy.
Gotcha.
So it's a case-to-case basis.
Right, which is great that you can actually provide, you know, a number of services so that you can really, you know, it's case-based and for the patient, and so that's really great.
Yeah.
Awesome. And how often would you suggest, like, is that another, like, if, you know, would you come weekly? Would you come monthly?
It does. It sounds like, I sound like a broken record when I say it depends, but it actually does. The best, most blanket recommendation I can give to my clients is that when they first start receiving stretch therapy, to receive don't make up your mind about it until you receive at least 3 sessions.
Gotcha.
Give your body 3 sessions to figure things out.
Right.
It's a little bit foreign. It is a therapeutic approach that heavily emphasizes less is more.
Gotcha.
And in order for the body to really receive that, you have to let it sink in for a little while. Some people, I would say majority of the population is really accustomed to thinking that they have to feel something very aggressive for it to be productive.
Right.
And this type of therapy is not like
getting
that.
carried out of a place and nothing
Yeah, no.
didn't work.
We don't want that happening here. This is not they actually legitimately teach you when you learn this technique that if you have created some sort of discomfort or a type of a bracing, that you as the therapist are doing it wrong. So I would say the recommendation would be give it 3 sessions.
Right.
And then depending upon how you respond is going to be the next recommendation for you.
Gotcha.
It might once a week might be great.
Right.
Your body might respond way more efficiently, maybe once a month.
Right.
It all depends. It all depends on what's going on.
Gotcha.
So.
And what are some post-op things after therapy or stretching that you give people?
This particular scenario, I would absolutely say 100% always hydrate.
Right.
Always, whenever you receive any sort of body work, even if it's simple as something.
Hydrating fixes everything. Seriously.
Water is the miracle drug.
Right.
Always water. And then I think a big misconception about therapy is a lot of people wait to come to you until something's wrong. Right?
Yeah.
So they wait to that point, they come see you, and then as the practitioner, you're most likely and hopefully always going to make them feel better. And then they feel better, and they go and do something that they haven't done in about 10 years. Right? It's very common that people will come back to me and say, yeah, Jamie, you did this. It was phenomenal. I felt so great. And then I ran 10 miles and I can't figure out what's wrong with me. And it's like, right. When was the last time you ran 10 miles?
Right. Exactly.
So it's keeping things in perspective.
Right.
There's never going to be one prescription for post or pre-treatment. It's going to be a trial and error.
Right.
Because everybody's an individual and is going to respond very differently. But I would absolutely say after any sort of body treatment, absolutely 100% always hydrate.
Right.
I would also say never do anything outside of your normal routine of a day.
Right.
Continue doing your regular work.
Exactly.
Don't go and sleep for 14 hours because you're so relaxed.
Right. I'm not going to get into a cartwheel competition.
Yeah,
I've never done that.
Yeah.
Right.
If you're not an Olympian, don't try to win a gold medal, try to keep it in perspective.
Right.
And then if somebody comes in with a particular ailment of some kind, then we can always address home stretches to do or at home.
Yeah. Because I don't think people really understand how important it is. And I'm still learning even at the age I am that, stretching is so important for your body.
Absolutely.
Everyday stretching, not just after a bad workout.
No.
But
No, absolutely. And I think that the common misconception with stretching is people are like, oh, well, I'm not a gymnast, I'm not flexible. It doesn't have anything to do with being flexible.
Right.
When you stretch something, you are essentially lubricating a joint capsule. Right. When you lubricate and open a joint capsule, you assist a neural movement. When you assist a neural movement, you help with muscular patterns.
Right.
That is the interpretation of what the stretches do for you.
Right.
If I sit like this all day, and I just do this 4 or 5 times, okay, fine, that's fine.
Right.
But it's not going to create a neural pattern that's going to actually hold your body in a place.
Right.
So stretching is not about being able to do splits. It's helping your body move better.
Well, thank you for having me here, and tell them how they can find you so they can try this stretching.
I actually have not exposed myself on social media yet. But you guys can find me on Instagram. It's my personal account. It's just my first name, Jamie, Jamie .roers, ROEHRS. You guys are more than welcome to DM me, send me anything you want, follow me on there. Outside of that, if you contact me through there, I'll certainly give you my personal information. But I have kept my reach very small.
Nice.
So
That's good.
I want to make sure that
More personalization and
I want to make sure that all of my clients really can understand the therapy.
right.
But I am accepting new clients, so
Excellent.
you guys are welcome to reach out.
Well, I'm on board. Thank you again, and I can't wait to be stretched out. Don't forget to like and subscribe. See you soon.
Bye, guys.